Thank you very much, Mr. Chairman. Thank you all. This has been a very educational hearing. As you can hear, there's bipartisan support for trying to figure out how we go forward. I've heard all kinds of things, figuring out the payment model when we're using new devices that you may not even have to go in to see the doctor on, and electronic health records. My concerns parallel those of Ms. Blackburn when she talked about devices. It was sometime a little over a year ago, we had an FDA representative in here, and I asked them about this $8 hack that had been used in Africa to send photographs to a hospital in the United States. You had a team of Canadian and I think Swiss doctors working on it, and they were able to identify parasites out of the stool of children and get a diagnostic fix, figuring out which parasite it was and do the treatment the next day. I said, would this be a medical device? And the answer was, yeah, if it's diagnostic, it's a medical device. Even though all they were doing was taking a picture on a smartphone with an $8 hack because it was being used diagnostic, the FDA thinks it's a medical device. So I think it's very important that we pass language that we can approve in a bipartisan way that clears that up so that, as she said in her statement earlier today, if it's a truly, something that's invasive, we want FDA making sure it's safe. If it's just diagnostic, we want to make sure that we get it to the market. And Mr. Jaron, I noticed, and it's in your written testimony and in your oral testimony, you mentioned like 15 devices that you could use that would give you some diagnostic capabilities without the healthcare provider being present. Are you all finding that that FDA is worried about that or spending a lot of time on that?
Well, actually, the X Prize included the FDA originally, so that way we wouldn't land into those issues and lack that clarity, because that was definitely an issue that we were considering, whether or not this would be obviously a medical device. So the FDA joined the project early on. I believe that Dr. Shurin, who may have been the person that you were referring to, actually even put a video on the FDA website about their involvement with the X Prize. So I'm hoping that when everything's said and done, we'll all be on the same page. One thing that I would mention, you have an excellent example of the kind of clarity that was needed, and it still needs. There's never not enough, right? Because that exact example is something that they actually ended up putting into the the final guidance, by saying that those mobile apps that can be used to visually augment, whatever a provider is dealing with in a diagnosis, would not be regulated under their enforcement discretion. So it was very helpful. Again, Congress is very helpful because when you ask those questions, I believe the agencies really do pay attention and listen. And the FDA, in that very specific instance, did exactly that. They did release the mobile medical apps guidance document. I believe that FDASIA tries to deregulate 95% of what they say very specifically, most CDS products and mobile medical apps and health IT software. But now it needs to be codified.
And we have to cut you short because we've got to leave a little time for Mr. Bilirakis to get a question or two in. I would say that not only is that important, I'm glad that they were listening, but that telemedicine is going to be very important. I represent a rural district, and it's going to be extremely important in the rural parts of this country. Thank you so much for that, Mr. Chairman. I yield back.
Chair, thanks, gentlemen. Now I recognize Mr. Bilirakis, 5 minutes for questions.
Thank you. I appreciate it, Mr.